Good day everyone, my name is Salvation S. Baltazar and I am from Group 5. Today we will be discussing about the infections of the respiratory tract. Let's begin with the learning objectives. It is to recognize common respiratory tracts based on their clinical manifestations. The second one is to describe the characteristics of the causative agents. And next one is to explain the mode of transmission of the infections. And lastly, to discuss the laboratory diagnosis, the treatment, and the prevention of each infection. Let's begin with the two classifications of our respiratory tract. The upper respiratory, which consists of the nose, the nostrils, the nasal cavity, the mouth, throat, pharynx, and the voice box. And the lower respiratory tract includes the windpipe, the bronchi, the bronchioles, and the alveoli. Respiratory tract infections may be caused by a myriad of organisms such as bacteria, viruses, and fungi. There are also several risk factors that promote the development of respiratory tract infections, and the most critical one is the environment. Let us begin with the diseases of the upper respiratory tract, which is the common cold. Common cold is considered as a common illness in both children and in adults. It is incidental and seasonal, and it's also tend to be predictable. Let's begin with the causative agent. We have here rhinovirus, which is the most common one. We have the coronavirus, which is the second most common. And we also have parainfluenza virus and respiratory syncytial virus. The clinical manifestations of common colds for children would include onset of fever, sneezing, runny nose, or rhinorrhea or coryza. And then the degree of rhinorrhea may increase with manifestation of nasal congestion. And the mode of transmission would be direct spread via droplet. This is caused by sneezing, nose blowing, contamination of external surfaces with nasal secretions. And the laboratory diagnosis for this one, there is actually no examination, but it could be checked by physical exam. And then the treatment would be supportive. For fever, we can give paracetamol, and for clogged nose, we can give decongestants, and for cough, we can also give them suppressants. And then for prevention, the very first thing that we need to do is to wash our hands regularly with soap and water, and then we have to keep our distance from people who are sick.
Fever infection occurs in association with streptococcal pharyngitis and caused by Streptococcus pyogenes strains producing streptococcal pyrogenetic exoticin, or formerly known as erythrogenic toxin. The toxin causes a hypersensitivity reaction producing a pinkish red rash on the skin. The rash balance with fresh is best observed in the abdomen and pastillanes or skin folds. The tongue has spotted strawberry-like appearance and will eventually become very red and large as the disease progresses. The skin feels similar to a sunburn. The drug of choice for treatment is penicillin G, since the disease is transmitted primarily by inhalation of affected droplets from affected person. Control measures are directed mainly at the human source. Otitis media refers to inflammation of the mucociliary lining, middle ear. 2/3 of cases are caused by bacteria, with Streptococcus pneumonia as the most common, Haemophilus influenzae as the second most common. Cause viral cause include respiratory syncytial virus, influenzae virus, adenovirus, and rhinovirus. The condition begins with nonspecific signs and symptoms of fever, irritability, headache, anoxia, and vomiting. Cough and coryza usually occur prior to the sign of ear infection, the most common specific manifestation is otalgia or ear pain. Other signs and symptoms include otorrhea or ear discharge, hearing impairment, and tetanus or ringing in the ears. Complications that many arise, if not properly managed, include perforation of the lymphatic membrane, mastocytitis, hearing loss, meningitis, and brain abscess. Managements involve taking antibiotics from the specific pathologic agent. Treatment is the broad-spectrum antibiotics, and prevention for this is monococcal vaccine.
Good day, my name is Melanie Madjak and my report is about streptococcal pharyngitis and diphtheria. Streptococcal pharyngitis is strep throat. Streptococcus pyogenes, called group A beta hemolytic streptococci. Clinical manifestation is fever, headache, sore throat, abdominal pain, and nausea. Mode of transmission is commonly spread through direct person-to-person transmission. Transmission occurs through respiratory droplets but can also occur through contact with secretions such as saliva, wound discharge, or nasal secretion from an infected person. Laboratory diagnosis. Clinician needs to use either a rapid antigen detection or throat culture to confirm group A strep pharyngitis. Throat culture is the gold standard diagnostic test. Treatment. Penicillin or amoxicillin is the antibiotic of choice to treat group A strep pharyngitis. Prevention is good hand hygiene and respiratory etiquette can reduce the spread of all types of group A infection. Next is diphtheria. Diphtheria is caused by Corynebacterium diphtheria, gram-positive non-spore-forming rod that are club-shaped and arranged in V or L-shaped forms to a Chinese character appearance. Toxigenic strain produce diphtheria toxin, which is responsible for the disease. Mode of transmission is airborne droplets of a carrier or patient or through the discharge from cutaneous lesion. Prolonged direct contact is required from transmission of the infection. Clinical findings. Inflammation begins in the respiratory tract leading to sore throat and fever. The most prominent sign is the thick gray adherent pseudomembrane over the tonsil and throat. Laboratory diagnosis. Swab from the nose, throat, or other suspected lesion must be obtained before antimicrobial drugs given. Treatment involves prompt administration of antimicrobial agent and diphtheria antitoxin to neutralize the exitoxin. Prevention are to limit the distribution of the toxigenic strains in population and to maintain a high level of active immunization.
Hey everyone, we discussed today is all about the pertussis or whooping cough. It's a highly contagious respiratory disease. Is also known as uncontrollable violent cough. It's caused by the bacteria Bordetella pertussis. They have the stage of Bordetella pertussis is initial stage. As a resemble a cold is the catarrhal stage. B is the accumulation of mucus in the trachea and bronchi, cause deep cough characteristic of the paroxysmal or the second stage. C is the convalescence or the third stage, can last for months. Tuberculosis. Tuberculosis is a bacterial infection spread through the inhaling tiny droplet from the cough or sneeze of an affected person. Infectious disease caused by the germs called the Mycobacterium tuberculosis. Mycobacterium tuberculosis or the Mycobacterium buphis caused by the bovine tuberculosis transmitted by unpasteurized milk. Mycobacterium avium or intracellular or complex in the last stage of HIV infection. Thank you.
And now let's proceed to pneumonia. Pneumonia is an infection involving the lung parenchyma. Most cases of pneumonia are caused by bacteria. It is classified as typical and atypical pneumonia. Atypical pneumonia is also referred as walking pneumonia, usually with milder manifestations than typical pneumonia and caused by other bacteria that are not common causes of pneumonia. Pneumonia may also be classified based on the areas of lower respiratory tract affected. It is referred as lobar pneumonia if the entire lobes of the lungs are involved. Interstitial pneumonia if the alveoli are not involved and the inflammation is confined to the interstitial spaces, while in bronchopneumonia if the bronchus and alveoli of the lungs adjacent to the bronchi are involved. Acute bacterial pneumonia typically presents with abrupt onset of fever and chills, cough productive of purulent sputum, and pleuritic chest pain. Community-acquired pneumonia is caused by S. pneumonia, which is common, M. pneumonia, and L. pneumophila. Other causes is H. influenza, S. aureus, and K. pneumonia in alcoholics. Nosocomial pneumonia often caused by E. coli, S. aureus, and P. aeruginosa. Most common cause is RSV, parainfluenza, influenza virus, adenovirus, measles virus, and varicella zoster virus. Diagnosis: gram stain and culture of blood or sputum. Streptococcus pneumoniae, also called as pneumococci. They are alpha hemolytic and are normal inhabitants of the upper respiratory tract of 5% to 40% of humans and are transient flora of the nasopharynx. The main virulence factor is the capsule, which is the antiphagocytic. Mode of transmission. Pneumococci is mainly transmitted through droplet respiratory secretions. Nasopharyngeal caries serve as source of infection in 10% cases. Clinical findings. The disease begins with the abrupt onset of fever and chills, cough, and pleuritic chest pain. The sputum is red and brown in color. The middle ear and sinuses are the most frequently involved, causing sinusitis and otitis media. The disease is terminated promptly and antimicrobial therapy is given early. Laboratory diagnosis. The gram stain and microscopic examination of sputum, blood and sputum culture, capsular swelling test, and optochin sensitivity. Treatment and prevention. The recommended drug is penicillin G. Alternative drugs are ceftriaxone and vancomycin. Primary prevention consists of administration of vaccine, especially to high-risk individuals such as the elderly and those who do not have a spleen.
Good day everyone, my name is Angeline Batulay and my topic for today is all about Mycoplasma pneumonia. So what is Mycoplasma pneumonia? It is a human pathogen that causes the disease Mycoplasma pneumonia, a form of a typical pneumonia related to cold agglutinin disease. The symptoms of Mycoplasma pneumonia is low fever, cold, headache, and the treatment is tetracycline. And the other one is viral pneumonia. It is an infection of your lungs caused by a virus. Influenza virus is the most common cause of viral pneumonia in adults. The symptoms is pneumonia in infants and the treatment is palivizumab.
Pneumocystis pneumonia is a serious infection caused by the fungus called Pneumocystis jirovecii. Pneumocystis jirovecii is found in healthy human lungs. The pneumonia jirovecii causes disease in immunosuppressed patients. The symptoms for this are pneumonia and the treatment needed is trimethoprim, sulfamethoxazole, pentamidine. Histoplasma. Histoplasma is a rare fungal infection caused by Histoplasma capsulatum. Histoplasma capsulatum causes a subclinical infection, occasionally progresses to a severe, generalized disease acquired by inhaling airborne conidia. The symptom resembles tuberculosis, and the treatment is amphotericin B.
Coccidioidomycosis, also known as valley fever. It is caused by a person inhaling spores of certain fungi. The fungi that cause valley fever is known as Coccidioides immitis or Coccidioides posadacea. They live in the soil parts of Arizona, Nevada, Utah, New Mexico, California, Texas, and Washington. It is named after the San Joaquin Valley in California. Symptoms of valley fever. These may include fatigue, cough, fever, shortness of breath, headache, night sweats, muscle aches, and rash on upper body or legs. The chronic form of the infection can cause lung abscesses and scarring in your lungs. Blastomycosis, on the other hand, is a rare fungal infection usually acquired by breathing in the spores of the fungi Blastomyces dermatitidis or Blastomyces gilchristei. These fungi can be found in moist soils, particularly in wooded areas and along waterways. Symptoms can include cough, fever, chills, muscle aches, joint pain, and chest pain. Blastomycosis is a potentially fatal fungal infection endemic to parts of North America.